Yesterday marked World AIDS Day, a day that aims to raise awareness about HIV and AIDS while continuing the commitment to prevent new infections and treat those living with HIV. The day also honors those whose lives have been impacted by the disease. Last week, Dr. Issac Bogoch spoke with us about how we can potentially eradicate HIV. And today we're building on that conversation by talking about how women living with HIV have been impacted and what support is available. So joining us live virtually this morning is Dr. Sharon Walmsley, a researcher in HIV studies and a senior scientist with Toronto General Hospital Research Institute. Dr. Walmsley, good morning. Thank you so much for your time.
Good morning.
Let's start with the distinction between HIV and AIDS. I'm sure a lot of our viewers know, but in case people don't, what is the important distinction that we need to understand?
Well, actually, today we don't make that distinction anymore. We really look at HIV as being a spectrum of illness. And the previous definition was related to potential opportunistic infections that people might have. But in today's world, what we really do is look at the spectrum of the immune system, and the particular part of the immune system that we look at is something called the CD4 cell count and the viral load. And the viral load is the amount of virus that is replicating in the system, and our goals of therapy are to get that to an undetectable level. And so we look at people along the spectrum in terms of the status of their immune system.
Mm-hmm. And as it relates to women, what are the statistics telling us in terms of new HIV infections and how much women make up the population for those infected with HIV?
Well, if you look around the world, actually more than half of the cases of HIV in the world have affected women. If we focus a little bit more on Canada, it's about 25%, including a quarter of the new infections in Canada are occurring in women.
Okay, and I also noticed in some of the statistics, according to Canada's Source for HIV and Hepatitis Awareness, acronym CATI, is that 68% of females living with HIV had a suppressed viral load compared with 75% of men. Is there a reason why we're seeing that?
So there are many steps to that. So first of all is you've got to get tested and know that you have HIV. And unfortunately, a lot of the people who may be at risk for HIV aren't aware of that risk and therefore don't go and get themselves tested. Mm-hmm. So once you're tested, then the next step is you have to access care. And of course, many gay men live in a community where they and their friends have the infection and they know the doctors to go to. Women often don't know another woman that has HIV and may not be able to know where to go for help. Mm-hmm. And then the third step of the equation is that you have to be prescribed and you have to take that antiretroviral therapy. And in many parts of the world and in parts of Canada, women may be living in poverty, may not have an access to a drug plan, and may not be able to access the therapies that can save their lives.
Mm-hmm. Dr. Walmsley, right now, Canadian or women born in Canada with HIV are told not to breastfeed for the risk of HIV passing through the breast milk. Is this something that you advise that is still true today, given the medications that are available, such as antiretroviral medications?
So we're of the belief that if your viral load is undetectable, that you cannot transmit. So that primarily applies to sexual transmission. And unfortunately, there is still a very tiny risk that HIV could be transmitted through breast milk. So in general, we still advise women who have access to a safe alternative form of formula feeding that they use that approach. But the guidelines really throughout the world are starting to change. And we're starting to recognize that if we treat the mother well and also put the baby on prophylactic therapy, that there may be an opportunity for women to continue to breastfeed. So that paradigm is really starting to change now. And many of the guidelines around the world now advise that we can support women to breastfeed if they so wish, provided that they are monitored carefully, that the viral load remains suppressed, and other aspects of their care are paid attention to.
And Dr. Walmsley, I want to follow up with what a conversation we had with our Dr. Issac Bogoch last week about this potential to eradicate HIV. How likely do you think that is, and what needs to be done today to get us there?
Well, it's going to take us a while to get there. And, we've known about HIV for many, many years. And unfortunately, we're still not in that situation. The key is for people to get diagnosed, for people to get on therapy, and for people to maintain that therapy. We've also continued to work on a vaccine, but unfortunately, this is a very difficult virus to develop a vaccine to, and efforts thus far have not been successful. But the big advances is in prevention therapy, and there are more and more agents that are available for prevention that may be able to be taken less frequently, as much as once or twice a year, that may allow people to protect themselves from getting HIV. So it's the combination of, being diagnosed, preventing one from getting infection, going on therapy if you have it, and ultimately the development of a vaccine.
It sounds like a multifaceted approach, but one that can be accomplished. Dr. Sharon Walmsley, thanks so much for joining us. Really appreciate your time on this important conversation. Take care.